physical therapy, what you could expect if you were coming in and you were one of my patients. Like I was saying, I would assess full picture, full body, see what's going on externally. And then if you're comfortable with it, we definitely do want to be taking a look internally at the pelvic floor muscles. As Jamie said, everything is always with consent. So sometimes patients aren't prepared for an internal exam at physical therapy, or they just weren't expecting that that was a part of it. Totally fine. It's nothing that you are like forced into, but it gives a ton of information. And if you are if you are going through fertility treatments and trying to get pregnant, it's definitely something that would help you in the long run if you're comfortable with it. So basically what a full pelvic floor assessment would be is exactly what I talked about for the shoulder, but for the pelvic floor. So basically, obviously you'd be in a private room, and we're assessing the external muscles, seeing if there's any pain, any tension, any sensitivity, and so on. So we kind of start externally, and then if you're comfortable, we can do an internal assessment. And that's literally where we're inserting our finger and assessing the muscles. We want the muscles to be able to lengthen and stretch. So going back to what Jamie was saying, traditional ways of conceiving is through sex. So if you're having pain with sex, pain with penetration, and it's that initial penetration, there might be some pelvic floor tension. And we treat that at physical therapy. So you think of other muscles that are tense in the body and we kind of massage them, we stretch them. Same exact thing here. Once again, they're just muscles. Once you kind of get that understanding that the area here is muscles, the muscles can be weak, they can be strong, they can be tender, there can be knots in them. So we're just treating them as such. If there's a lot of tension in the muscles, we're just holding pressure on that area, guiding you through breathing. There's a huge connection with breath and the pelvic floor, and we can kind of get the muscle to release. If we find you also have a ton of hip tension and maybe a lot of back tension, then we're also going to be treating the back and the hips, doing stretches for those areas, and it can transfer over to the pelvic floor. But sometimes people are kind of like, okay, I have pain with sex, but what are you going to do about that? So once again, there's different reasons why you might be having pain with sex, but likely it's because of some type of muscular issue, whether once again it's tension or laxity causing organs to kind of start to push down. Maybe your partner's hitting those areas and that can't be comfortable. Or there could be a trigger point or like a knot in the muscle, similar to a knot in your neck. And if your partner's hitting that over and over, that can't be comfortable. So by doing a direct pelvic floor assessment, we can kind of see what's going on, see if it's more tension related, see if it's more one-sided than the other. That's really common as well. We have a dominant side, and it's really common to have one side that's really tense, and then we check the other side and the patient's like, oh my gosh, I had no idea. And maybe you have an injury, to your right hip, and now that's caused tension on the right side. There's so many different things that can cause dysfunction at the pelvic floor. And that's why we look directly at the pelvic floor, but then we're also looking outside as well. I always kind of tell my patients the body is like a giant group project. You go back to high school and your group projects. Each area has the range of motion it needs, the strength it needs to do everyday things like walking. We need like full extension of our knee to walk properly. If your knee is a little stiff, you're not just going to not walk. You're still going to walk, but there's an area of your body that's now taking on more work than it's supposed to be. And it's okay at the beginning, but then over time, that increase of work is kind of building its way up. And then eventually that area is going to hurt and it's going to be like, I don't want to do this extra work anymore. And so like that can affect it. If you're having ankle or knee or hip issues, it can travel its way up to the back and up to the pelvic floor. So we look externally to also treat kind of like what we call like indirectly, and that can decrease the stress that's going to the pelvic floor.